Namaskar, friends. Today we'll make a case study. We know the step one is to track health score on 10 parameters. We all know the seven blood tests, all that. So this gentleman, 48-year-old gentleman, 5 feet 6 inches, when he got his test done, his health score is 30%. He has a high fasting insulin and very, very high severe insulin resistance, 6.74. And his HbA1c was, I think, 11% last year and around 10, 11% last 2 years. And surprisingly, he was telling me I was not taking any medicine. I was shocked. How come? He says, no, I was not taking any medicine. And he says he has no symptoms except a little dark skin and all that. And when we see his D vitamin B12, say out of 10 parameters, he was okay only, and three parameters. So what are the problems he has? Severe diabetes, dyslipidemia, he has got high triglycerides, 196, it should be below 100. Is this particular triglycerides to HDL ratio is also high, and then he's overweight, not much overweight, little overweight, low D vitamin and B12 vitamin. Health score is 30%. So what he did, he followed what I was telling him when I saw this report 11% 1 2 years ago and 10% on 7th January. I strongly suggest him to talk to the doctor. But somehow he was following our 10 daily steps, and he was doing no carb food and he was taking the supplements. And after 1 month, he shared his report. I was amazed. It's an amazing success from 10% from January 2024. He came to 8.6%, and health score is improved to 80%. He lost his weight, and his insulin sensitive. He become insulin sensitive. Remarkable. This is the first time I'm seeing such a wonderful results in a month. Now I want to understand how come he got such wonderful results. Possibly, since this gentleman was not taking any medication last 2 years, probably his body is adapting. Understand, friend, diabetes is not a disease. It is an adaptation. Blood pressure is not a disease, it's an adaptation. So the body is adjusting. Body has a homocystic, what is that called? Homeostasis. These medical terms, I'm not very clear about it. Homeostasis, that means balancing. It does the balance work. So he followed and improved his health to 80%, and I'm very, very happy. And what is most important, friend? Insulin sensitivity. How one can become insulin sensitive? Just eat twice in a day, no carb foods, nothing in between 2 meals except water and hydration and elimination and taking care of D vitamin and B12 supplements, and then stress management, exercise, and night sleep. And these things had helped this gentleman. And I met him when I was giving a session in this government arts college, I think yesterday. It was a very, very pleasing for me. I have at least two, three people who have benefited substantially from the college. So that's how they've arranged a talk for me. Now let's look at it, friends. There are 7 stages of insulin resistance and type 2 diabetes progression. So that means all type 2 diabetes are not same, friends. Understand that. All two type diabetes, there are at least 4 different stages. There are 3 different stages of insulin resistance, and there are 4 different stages of diabetes. That does not mean there are in between. It's like a continuum. If it is like a landmark, say train is going from Chennai to Vijayawada, landmark is Gudur, next is Nellore, like that. Stages are there, friends. Let's look at those stages. Understand that. See, understand the best is what? Optimal, which of course hardly anybody has, because 90% of the population are insulin resistance are very. Why 90%? Because the 10 days takes, repeat takes for years. So obviously we are all bound to get it. Suppose all of our walking without chappal and pebbles, hard rock, we are bound to get injured. Similarly, when we do all these 10 wrong habits, day in and day out for decades, we are bound to get the lifestyle disorders. So what is the best, friends? Fasting glucose should be below 90 milligram per deciliter. HbA1c below 5%. Very, very clear. Fasting insulin should be 3 to 6. The lab says 3 to 25, but the best is to have the minimal. Let's look at what is the stage one. What is insulin resistance? Fasting blood glucose multiplied by fasting insulin divided by 405, the value should go 1.5. We have just seen the other gentleman. He was having insulin resistance of 6. Now he come to below 1.5. Insulin resistance mild is 1.5. That means it's higher. And fasting glucose will be below 99. Not having any high sugar, friend. HbA1c is also normal. Only fasting insulin will be above 7. Because many times we do only fasting glucose, we say we have no problem. But by the time people are developing belly fat and probably overweight also. What is stage two? It may take 3 years, 5 years, 10 years. We don't know from one stage to other stage. The train we know because it's going at a regular speed. We know from Chennai what time it reaches Gudur, but we cannot say a healthy person, when he will reach stage one of insulin resistance. Then stage two. Stage two also fasting glucose is below 99, HbA1c is below 5.6. Fasting is above 7. Understand from 7 means what? It could be 8, 9, 10, 15, 20, 30. We don't know. But definitely above 7. So you need to check that. Third, insulin resistance severe. That means there is resistance above 5. Very, very high. 5 means it could be 5, 6, 10, 15. I've seen with 15 also. Fasting glucose is below 99 year also. A1C is below 5.6%. Fasting is above 7. So friends, by checking fasting glucose, you are getting misled. Fasting glucose checking is highly, misleading. The controlled parameter for many, many years, fasting glucose will be under control. Why? God has created such a wonderful mechanism for us. The insulin will produce higher insulin to control the sugar because higher sugar can cause problems to your complete blood circulatory system. People can get blindness, kidney failure, all those problems will happen with high sugar. That's why doctors will tell you, no, you are a type 2 diabetes, you have to control your sugar. But God has done it for many years. They are not bothered. What is stage four? Acha, in stage three, friends, many times they find their PP sugar is lower than fasting sugar. Generally, fasting sugar will be lower because we did not eat for 12 hours. Suppose we drank 75 grams of glucose powder, obviously your sugar should go up. But especially stage three, at times stage two also, PP sugar will be lower than fasting sugar. That means fasting sugar could be 90, sugar could be 80. Highly, highly misleading. People can't decipher it. This is because of severe insulin resistance. What all happen to these people, friend? They'll feel frequent hunger, develop belly fat, they'll develop belly obesity, fatty liver, cardiovascular disease. Means what? They may have high triglyceride, low HDL, high cholesterol above 200, high LDL above 150 or so. PCOD problem, PCOS, their thyroid, blood pressure, and all. But all these people will have normal sugar. HbA1c also normal. Now comes pre-diabetic. Next stage is insulin resistance and pre-diabetic. Pre-diabetic means what? Sugar levels are slightly gone up, 125, 126. But many times I've seen pre-diabetic patients, their fasting glucose is below 100. And whereas their HbA1c could be definitely by above 5.7%. Friends, understand, for knowing pre-diabetes, insulin, HbA1c is a must. Above 5.7% is clear pre-diabetes. Lot of people tell me, no, sir, borderline and under control. Please, friends, you have already put your food in a dangerous water. So you got to be careful. And then their fasting insulin will be above 7. It could be higher. We don't know. Friends, in US, I understand 1 out of 3 are pre-diabetes because of course they eat junk food, they eat multiple times, they have a lot of ice creams, cool drinks, and all that. So they're bound to have, pre-diabetes. 1 in 3 is common. Maybe 1 in 2 also now. I don't know. And incidentally, the statistics say out of 10 pre-diabetic patients in US, 9 of them not aware they have pre-diabetes. Quite dangerous situation, right? You're in thin ice. We don't know when it is going to break and you're going to fall into the cold waters. So how do we know whether you're pre-diabetes or not? HbA1c test. HbA1c test costs 250 rupees. I'm surprised. How come such an advanced country like this, with such wonderful facilities, such affluent people, people with a lot of knowledge and great resources, they can't do a 250 rupees test. Why? Because many times people are only looking fasting sugar, friend. Very unfortunate. And also, a lot of patient people are bothered to get the test done. They say, no, no, I don't have any symptom. Are you waiting for symptoms, friends? What are the blood sugar symptoms? Frequent urination, and then frequent hunger, and wounds not healing. All these things means what? The water has come up to your nose. Don't wait until that time, friends. Now, what is the next stage? Is diabetes. That means the HbA1c is above 6.5%. See, the time period from stage 1 to stage 5, some people can come very fast. See, I always tell people from the date of birth, death, we are our own graves, friends, to bury ourselves. What does it mean? See, what is the grave? about 6 feet, maybe about say 3 feet depth. So suppose you are digging your grave with your fingernail. It will take long, long time. Somebody is in a great hurry. That means he is taking frequent eating, he is taking lots of high carb foods, all sorts of wrong habits. Like we said, all the 10 bad habits we talked about it. No, what are the bad habits we are doing day in and day out? Like no hydration, no elimination, high processed foods, coffee, tea, stimulants, not sleeping well, no stress, highly stressed, and all that, eating multiple times in a day, and all that. All these things are habits which will propel you to pre-diabetes and diabetes, friends. So these things we need to keep in mind. And so we are all digging our grave. Somebody is digging with a crowbar. So he will dig faster. Somebody has used a JCB, it's an excavator, and some people are putting an excavator friend on both the sides they're digging. That means what? They have all these 10 bad habits and they're accelerated more in trying to be their own maker. So friends, pay attention, stop 10 bad habits, check your parameters, and know where you are. What is the sixth stage we have seen? The diabetes. Next is this is severe diabetes. That means what? The sugar levels are very high. The insulin levels are not very high, but it is coming down. Friends, understand by the time you are diabetes, your pancreas must have lost its capability more than 30, 40, 50%. We don't know. But severe diabetes is a very clear indication that your pancreas will not be functioning beyond 20, 30%. It all depends on your luck because a lot of comorbidities, there are each individual is different, friend. What happens to 1% cannot happen to the other percent. So here, maybe fasting insulin is low, little bit. The insulin resistance also not very big, but they are already moving type 2 to type 1 diabetes. The stage 7, severe diabetes. That means what? Their pancreas is totally gone fat. They have become like a type 1 diabetes. What is type 1 diabetes, friend? Type 1 diabetes is a autoimmune disease. Their pancreas is not working. It is not producing insulin. It's God's grace. I mean, the medical fraternity done a fantastic job of creating an insulin. That's why the type 1 diabetes are alive. Otherwise, before this insulin invention, type 1 diabetes would not survive more than 3, 4 months. Right? Now, what happened, friend? Type 2 diabetes patient, by our not understanding the process, taking the medication, number of times, we are converting ourselves from type 2 to type 1. So when I see this gentleman who had improved his HbA1c from 10% to 8.6%, I was wondering how come? Probably, I don't know. I think I was speaking to Dr. Nehru also. Probably, gentleman has not taken any medication. So that could be one of the reasons. Though his HbA1c is very high, he may not have any symptoms. There must be damage is happening to the body, but we have looked at it. Not much happened so far, luckily for him. So friends, understand indications. When by the time you get indications, it's too late. Again, when you go to any doctor, when moment you get it, the other day I see one gentleman, his HbA1c is 5.8%, and he has been taking medication for I think, last 7 years. He's a doctor. He's one of the faculty in the college. He was talking to me. I was surprised to see his HbA1c, and he says he's taking two medicine for so many years. I wanted to know what is his fasting insulin. As usual, the particular, the clinic and the doctor, they've never checked his fasting insulin, friend. Maybe his pancreas is making tons of insulin and you are giving medication. There are different types of medication. Some medicines, what to do, they don't absorb the sugars in the stomach itself. Some things will improve your insulin sensitivity. Some medicines will whip up the pancreas to produce more insulin. Very unfortunate, friend. Anybody who's diabetic, before doctor putting any medication, they must establish how is their pancreas working? How much insulin their pancreas is producing when in a fasted stage, after 1 hour stage, after 2 hour stage. Based on that only the medication should happen. But unfortunately, moment you want high sugar is there, you give a medicine, you bring it down, you feel happy. So let's understand this, friends. The 7 stages of diabetes. All group members, all of them are most of them seems to be spectators. They're saying great, claps and all that. It doesn't work, friend. I want you to be an active participant. So please take your these 7 blood tests, create your health score, share in the group. And one more gentleman, he was doing all this about Dinacharya 10 out of 10. They are doing 10 out of 9. Whereas this gentleman from 10% to 8.6%, he told me that he's following 10 out of 10. He took the supplements. He has taken no carb food. It was absolutely disciplined. I can tell you, friend, though I don't believe in forecasting, this gentleman HbA1c will definitely come in 3 4 months, probably below 5.6%. I have a couple of case studies, because the earlier you catch the problem, is easy. A stitch in time saves nine. Friends, these are the few people who have benefited by following this wellness secret. 30 wellness secrets. You must know all the 30 secrets, and you must follow all the 30 secrets to improve your health. There's three-step approach. We all know. First step is to know your health score as of today. Just to know those 10 wrong habits which you are following every day, you stop them and follow these 10 daily habits, dinacharya, and follow 3 4 months. I can guarantee you fabulous results, friends. Friends, my name is Gangeshwar Rao. I'm not a doctor. I'm not giving any medical advice. People with heart problem, diabetes, kidney problem, any other health problems must consult their doctor. Don't give up any medication based on my talk and all that. Consult your doctor and take appropriate action. Friends, what you require is the right knowledge. See, all of us are very proficient in our profession. As an automobile engineer, I was very proficient in my job. I have been promoted as engineer to senior engineer, manager, area manager, service head, then the sales manager, marketing head, journal manager, south head, and all that. Unfortunately, until 2014, I had very, very wrong knowledge as no knowledge. Once I learned about Dr. Mantina's book, I've improved my health. Last 10 years, I've invested more than 7,000 hours. I'm passionate to share all this knowledge to you. You can learn all this in a span of 1 to 2 hours. All the data is available. I can share the PowerPoint presentation. I can share the Excel sheets where we have looked at these case studies. So pay attention, friend. Please share to your friends. If you want any free guidance, you can call on my mobile number 9840852996, and you must share with me your health score. Then we can discuss. And if needed, you must consult the doctor, take medication. We must look the total. I've seen a recent case study, friend. One lady was going last 7 years for thyroid problem, and she joined my program in that Gurukula app. And January, I mean, I think January, she shared her thyroid report to me. I said, what is this? I don't want to see your thyroid. I want to see your health score and 10 parameters. She did not get it done. She followed, I think, about a month or so, and she shared her thyroid has come down from TSH from 782, come to 3. She was extremely happy. She said, sir, thank you very much. I said, no, I'm not happy. I want to see your blood report. Surprising, friend, when she got all these 7 tests and she shared me, she was diabetic. Her HbA1c is 7.2%. We don't know how long she was diabetic, and she was regularly going to the doctor. She was under the care of doctor. I've seen such many cases. We are all handling these cases specifically. I've seen some cases people are going for cardiovascular problems. Their cholesterol is very high and the LDL is very high. They're under treatment for years. And I have seen many cases they have not even done HbA1c, and the guy is overweight. This is what is happening, friends. So please invest time to acquire the right knowledge. If you like this video, subscribe to my channel, share to your friend, comment. Thank you very much for listening. I appreciate your patience.